Ladies and gentlemen, thank you for joining us this evening. Our program is about to begin. If you'll please make your way to your seats, our program is about to begin. Thank you. Ladies and gentlemen, please take your seats. Our program will now begin. Thank you. Ladies and gentlemen, it is our pleasure to introduce Partners in Care Foundation President and CEO June Simmons and Board Chair Catherine Kirchhoff.
Wow, what a crowd. Whew. Thank you. A warm welcome to all of you. Thank you so much for joining us, celebrating this, our 22nd annual tribute dinner. Here we are, driving social care and health care alignment, the dream of many years. So it's a great pleasure having you with us to celebrate the Partners in Care Foundation and our wonderful two honorees, Dr. Artie Southam and Dr. Sachin Jain, for these prestigious awards. We are so proud to have them here to receive our awards. Well, they are awesome. On another note, today is also special because it's the first time in our country's history that we're formally celebrating Juneteenth as a federal holiday. This is what they call a great crowd. Commemorating the emancipation of enslaved African Americans. It's a notable and auspicious day, and its recognition is long overdue and well worth celebrating. Our esteemed colleague, Elaine Batchelor, shared some thoughts with me about Juneteenth. You know she's CEO of Martin Luther King Community Healthcare, and she reflects as follows. I am uplifted by the example of the many people who've come before me, who have fought and taken a stand for equality and who have helped bring about the progress we have made. They inspire me, she says, and motivate me to do the work I do, to pursue equity for my community, and to believe in the possibility of change and progress. Those of you who know Elaine and her work here, her amazing work in Los Angeles, recognize her passion. I'm sure I speak for all of us in thanking her for sharing these thoughts with us today. For the past 24 years, Partners in Care has been bringing together health leaders from throughout California and the nation to this event to recognize outstanding peers. During that same time, I'm proud to say Partners has also served as a thought leader, exploring and developing the concept of what the social determinants of health look like in real life. Takes a specialized approach to answer those needs. But doing so means your patients and members can recover to their fullest when coupled with medical treatment and then live as independent citizens in the community. So looking back across the years since we started hosting this tribute dinner, our work with the social determinants has evolved from cutting edge, kind of a new idea, to broadly adopted by healthcare providers, policymakers, payers, and the general public. Many of you have traveled this road with us, watched our progress, helped us achieve this amazing position. So it's a great honor to say thank you to each of you for being here tonight and for believing in what the Partners in Care Foundation represents. Not used to all this applause, but it certainly is fun. So we're here this evening really to honor two amazing individuals, Dr. Southam, and Dr. Sachin Jain, and recognize the tremendous leadership they have provided throughout their impressive careers, both here in California and nationally. These honorees exemplify the same kinds of inspired leadership and impact in shaping healthcare that have been recognized and celebrated in past honorees. You'll hear much more about both these gentlemen later in our presentation, but now I'm really pleased to introduce Catherine Kirchhoff, our board chair at Partners in Care Foundation. While this is Kathy's first year as our board chair, she's been actively engaged in Partners board for 6 years. It's a great board. And she's managing director at Cain Brothers, where she applies more than 30 years of experience, young as she looks, helping clients with capital funding, financial planning, feasibility analysis, and strategic planning. Our chair, Kathy Kirchhoff.
Thank you, June. It is an honor to be here tonight with you and to celebrate both the accomplishments of Partners in Care Foundation and our distinguished honorees, Dr. Arthur Southam, Executive Vice President of Health Plan Operations and Chief Growth Officer at Kaiser Permanente, and Dr. Sachin Jain, President and Chief Executive Officer of the SCAN Group and SCAN Health Plan. Both our honorees have applied imagination, experience, and significant talent to their leadership roles. They are tenacious advocates for their vision and actively serve as agents of change, striving to bring excellent, equitable, and accessible health care to the people of California and this nation. We admire their expression of these qualities and their alignment with Partners' mission-driven work and our own role as change agents. From the very beginning, Partners has been a national thought leader in the development of social care models. Our goal is to change the shape of healthcare by explaining, then demonstrating the value of social care in furthering the healing process, thus enabling people to maintain their independence and remain at home. We have been described as visionary for our development of innovative and powerful models of social care coordination. For the past 24 years, Partners has worked to align social care and health care to improve the lives of people with complex health needs. In that time, we have seen our care models adopted both in California and nationally. This strategic alignment of healthcare and social care is already taking shape here in California. Under the state's recent Medi-Cal redesign, known as CalAIM, we are starting to witness the earliest evidence of its improvement in health and wellness for the highly vulnerable, medically complex people we serve. As CalAIM creates the mechanisms to address individual social drivers of health, we are seeing results in the healthcare industry, both here in California and across the country, and the healthcare industry has taken notice. Yet, there is more to be done. With June's leadership, the members of the National Partnership to Align Social Care are tackling difficult, sometimes thorny, issues that have kept social care in a silo, separated from health care and health plans. The extraordinary members are on the slides you see here. With strong representation from all the key stakeholders, including the federal government and CMS, we see real possibility for meaningful change to improve people's health, social circumstances, and lives. Each of us has a role to play in realizing this vision, and we are grateful for your support tonight and throughout the year to bring this vision to reality. Last year, we came to this event and issued a clarion call that the time is now for healthcare, health plans, and community-based organizations to begin working together. We are encouraged by the progress that has been made and the leadership that Partners has contributed to this critical work. Tonight, we are proud to be in the company of so many innovators and leaders. Who better to ask to join us in driving the alignment between social care and healthcare? Working together, we can keep these innovations going so that we can ensure the opportunity for everyone, regardless of life circumstances, to live with dignity and optimal health in a home of their choosing. June?
So it's my honor to bring to your attention now some of the evening's sponsors who make this possible. Your generosity has been key to making this great evening come together, and we will be recognizing the sponsors throughout tonight's program, both here on stage and on the screen. Please take a moment to look through the tribute journal. You'll find at each table to see the organizations and individuals who have supported tonight's dinner. Be sure to take a copy home with you for future reference. It's a beautiful book this year, I must say. First, we'd like to recognize our premier event sponsors. Children's Hospital, Los Angeles. Thank you, Mr. Viviano. Kaiser, Permanente. The SCAN Group, SCAN Health Plan. So the generosity of these three wonderful organizations is well known throughout our state, California. Our deepest thanks to each of you for your significant support tonight. And we, of course, also want to extend our warm appreciation to Paul Viviano, President and Chief Executive Officer at Children's Hospital, Los Angeles, for both his and the hospital's tireless efforts on behalf of tonight's celebration. He has helped take this to the top.
It is my pleasure to thank tonight's diamond sponsors: Aetna, Common Spirit Health, and the Don Levin Trust with Edna and Tom Gordon. Their participation as sponsors is critical to supporting the work of Partners in Care Foundation and addressing barriers to health equity among our most vulnerable populations. Thank you.
Now, we'd like you to meet a group of individuals who are essential to the agency's success. Saying goes that board members should bring wealth, work, and wisdom to their role. Our directors do that and so much more. The Partners in Care Board of Directors is very instrumental in guiding our work, so I hope you'll take every opportunity throughout the evening to ask them any questions about Partners and share your thoughts with them. You will recognize them as the guests with the blue colored ribbons on their name tags. You've already met our accomplished board chair, Catherine Kirchhoff. I'd like to ask the Partners board members to please stand and be recognized. Well, while this year has been notable for many successes, we also suffered a very significant loss. We'd like to acknowledge Eve Curtin, a dear friend, treasured board member, supporter, former board chair, passed away following a long illness. Eve was such a widely respected trailblazer in the healthcare industry, remembered for her innovative spirit, her strong leadership, generous heart, a real force of nature. We will always remember and appreciate her vision and wisdom as she helped to guide the growth of our organization over so many years. She's greatly missed.
Partners has been the leading community innovator in the field of social determinants of health for more than 24 years. In that time, we've developed a number of tools that drive successful coordination of care services in the homes of vulnerable, at-risk individuals. It is my pleasure to introduce this video overview of the agency and two of the valuable tools in our care coordination toolbox. Our sincerest thanks to Kaiser Permanente for its generous sponsorship to make this video possible.
Here at the Partners in Care Foundation, our work aligns social care and health care in order to address the social determinants of health that routinely affect diverse, underserved, and vulnerable populations. So what do we mean by this? Well, most of us have struggled through a stretch of illness or experienced a major medical intervention at some point in our lives. For some, a full recovery meant speedily returning to our typical day-to-day activities, although for many, that just isn't the case. Complications can stem from any number of factors, even beyond the nature of the illness itself, like a patient's home environment, access to basic needs like food, rent, or medicine, or even a misunderstanding of how to provide ongoing care for given conditions. These and numerous other combinations of factors make up those social determinants that can, and often do, hinder recovery or even lead to ongoing complications or further risks over time. This is where Partners in Care Foundation comes in.
We like to say Partners serves as a bridge between medical care and what individuals can accomplish on their own at home, achieving greater effectiveness of care. Partners programs and services have been demonstrated to improve quality of life and help participants avoid suffering, as well as reduce costly hospital readmissions, emergency room visits, and nursing home placements.
The Partners Care Coordination process starts with personal engagement, then an assessment, the development of a specialized care plan, and finally, implementation of circumstance-specific interventions. This process involves the evidence-based tools in our care coordination toolbox, which include our highly effective engagement center that improves client reach and engagement rate, and Home Meds, our in-home medication inventory and review program. Did you know that Partners Home Meds is proven to reduce medication-related injuries and cut emergency department and readmission costs for high-risk patients? Home Meds does this by inventorying all the prescribed medications, over-the-counter pharmaceuticals, herbals, and supplements in the home. Then, proprietary algorithms identify any unnecessary therapeutic duplication, any false risk or confusion related to inappropriate psychotropic medications, and any cardiovascular issues related to medication use. Then it automatically alerts the pharmacist and issues a report, including suggested modifications of the prescription. Not only does Home Meds improve a person's health and safety, it also increases Medicare Star quality ratings, reduces use of high-risk medications, and improves adherence to medications for chronic illnesses, which ultimately reduces the risk of falls and hospital readmissions. Lastly, Home Meds supports HEDIS quality measures for physicians by reducing the use of high-risk medications, providing a fall prevention solution, and identifying drug interactions. Home Meds helps people get their medications just right.
To this day, a phone call remains one of the most effective means of reaching and communicating with people. Our staff at Partners Skilled Engagement Center enjoy a high success rate in reaching individuals and equal success at convincing them to set up appointments, enroll in programs, or connect to different services and resources. Our team and technology locate and engage individuals quickly, starting with an intake process that gets to the heart of a person's medical, social, environmental, or financial issues. Our engagement center has been used with great success by providers, health plans, hospitals, and other organizations throughout the United States. And it is available to any businesses needing skilled outreach. Our staff have frequently supported outreach for clinics, offices, and health plans with the goal of improving participation in a variety of areas. The staff of Partners Engagement Center gets results. We were hired to conduct an outreach and enrollment of high-utilizing health plan members into a social care coordination program in California. And we were able to achieve a 93% engagement rate in our contacts. Engagement is our key to success.
For more than 2 decades, we at the Partners in Care Foundation have been innovating and improving social determinants of health, or SDOH, solutions, and driving life-changing, life-saving alignment between social care and health care for those we serve. Well, thank you. You're the most expressive audience we've ever had here. What a joy. So it's my distinct honor to bring to the stage another great board member, Jennifer Heenan, whose wise counsel and patient guidance and sheer energy has made her a great success as chair of Partners Tribute Dinner Committee and brought us all to this place tonight. Jennifer Heenan, would you please join us?
Good evening, everyone. It's fantastic to see you all in person, and I hope you're having a wonderful time. Before we proceed with tonight's program, I'd like to take a moment to publicly thank Karen Schneider, Partners VP of Development, and her team for their tireless efforts to make sure that this event's a fun night for you all. Thank you, Karen, for your leadership. It's been my distinct honor to serve on the Partners in Care Foundation Board of Directors and as the 2022 Tribute Dinner Committee Chair. As chair, I've had the opportunity to work with some of the most extraordinary individuals to make this evening's event the best one yet. Would members of this year's dinner committee please stand? Thank you all for your efforts. Tonight is a very special evening. As Partners in Care Foundation approaches its 25th anniversary in 2023, I'm honored to introduce you to the recipient of our Vision and Excellence in Leadership Award, Dr. Arthur Southam. Dr. Southam, or Artie as he's known to many here, is a unique kind of leader known for his depth of experience, his vision, and commitment to high-quality, accessible healthcare. As the Executive Vice President of Health Plan Operations and Chief Growth Officer for Kaiser Foundation Health Plan and Hospitals, Artie oversees marketing, sales, service, administration, and the business development teams. Artie joined Kaiser Permanente in 2001 after serving as Chief Executive Officer of HealthNet and Care America Health Plans and CEO of Health Systems Design. In addition, he now serves as Chairman of the Board of Christus Health, a position that he's held since 2015, and he is an esteemed member of the Partners in Care Foundation Board of Counselors. Artie hails from the other coast, specifically New Jersey, and completed his undergraduate degree at Amherst College, where I am told he was involved in swimming, water polo, and was a member of Kaiser, dubbed the Fraternity of Gentlemen. We now happily claim him as a Californian, having earned his MD and MPH at UCLA, an MBA from Pepperdine, and completed his residency training in internal medicine at Cedars-Sinai. And now I'd like to turn your attention to the screens to hear more about this visionary leader.
At Kaiser Permanente, our mission is to provide high-quality, affordable health care and to improve the health of our members and the communities we serve. Over the past 20 years that I've worked with Artie, this has truly been his North Star.
So many individuals have benefited from Artie's leadership.
He's always intentional, he's always supporting, he's always patient. He's never expecting perfection.
He's just a real, extremely strong team player. And it's clear that he likes being a team player.
I've never met a leader who is so generous with his time, always fully present.
He's always available. He's always ready to support people. He's always ready to mentor people.
He shares the human aspect of things that he has gone through and the challenges that he has gone through that make him a much more real human person.
Dr. Artie Southam is one of the real ones. He really is not only about talking the talk, but walking the walk.
I think that health and access to the things to improve health is a fundamental human right. It's not something that everyone has. It's something that everyone should have.
Artie truly believes that unless we go upstream, so we can change the systems, we can change the policies, we can change the environments to prevent people from ending up at a point where they do need to have those social needs met, that's when you can make much more important transformation. That's when we can make a bigger difference.
The Affordable Care Act, when this came along, Bernard Tyson was part of this, Greg Adams, George Halverson, and said, well, we're not going to think too much about whether this is going to be profitable, and we won't think about whether it's going to be easy, and we won't sit it out and wait to see if it works. We will be committed to aggressively implementing the Affordable Care Act because we think every American should have access to high-quality, affordable, coordinated care and coverage.
Artie's a great proponent of technology. He's always looking for a way to modernize and automate business processes, and it was through Artie's leadership and sponsorship that we were able to stand up what is one of the largest telephony platforms in the United States.
KP.org changed the healthcare communication industry. The whole internet thing that's happening now didn't exist. He was the only one on the executive staff that thought it was a good idea for us to invest that money in that approach.
Within our work and team at Kaiser Permanente, we are imperfect. Our society is imperfect. I'm imperfect in doing this. But we're continuously reminding one another that it is our goal to create an inclusive, diverse, and equitable environment.
Artie, you are truly a special leader. You demonstrate courage by leading difficult conversations about social injustice and racial inequity.
I love the fact that he wanted to be a direct sponsor for our equity, inclusion, and diversity team. And he's not a sponsor in name only. Artie shows up. He comes and he participates directly with our champions in small listening sessions. And what I feel from him is that we are comfortable with being our best authentic self, and that there's an understanding that we're valued in terms of the work we bring to the table.
Artie defined convention when he arrived and broke with traditional practice by retaining top talent, regardless of gender, color, or academic pedigree. And he also promoted women to senior level positions. I am one of many women who grew professionally and personally through the gift of your time and energy.
We serve 12.5 million people who entrust us with their health care. Those 12.5 million people come from vastly different backgrounds. It's our job to be the chosen coverage and care provider for any and all of them.
He never takes credit. He's always giving it. He would never say, I did that or I led that. He's always saying the team did that.
He is a great leader because he is extremely intelligent. He has excellent personal values and integrity. He is trusted because he deserves to be trusted, and people know that.
Artie is authentic. You know, we want to be right alongside him.
Artie, on behalf of everyone at Kaiser Permanente, congratulations on this well-deserved award and recognition.
This honor is so well-deserved, and I'm grateful your service is being acknowledged in this way.
I feel proud and privileged to have worked so closely with Artie for so long. I learn every day from him, and he's made me a better leader and a better person.
Artie, I just want to thank you for always taking the mantle and being an example of what we want all leaders to be.
What could make us more proud than both doing our day-to-day incredibly well, but then also having impact, meaningful impact through tangible, concrete actions, initiatives, execution that get at those things that make us less than we should be as a nation and in our communities. We're not there yet, but we can get better and better every day.
Please welcome Honorary Tribute Co-Chair, Tribute Dinner Committee member, Chairman of the Board of DSL Construction and Co-Trustee of the Don Levin Trust, Tom Gordon.
Artie, where are you? Oh, hi. I couldn't see you. Should have got a better table. So good evening, everybody. I don't even know where to start. I will start by telling you a loving wife, beautifully and accomplished children, an amazing career, wonderful reputation, but enough about me. I have the privilege of introducing my colleague and dear friend, Dr. Artie Southam, to all of you tonight, who doesn't need an introduction. I'm the former CEO of the Cedars-Sinai Medical Network. I've known Artie for a long time. He's clearly one of the kindest and smartest people I've ever met in this business. His name is a synonym for integrity in every way humanly possible. He's unassuming and without guile. Artie brings with him something that restores confidence in C-suites across the country when it's desperately needed. Never having aspired to national prominence, he was not consumed with driving ambition. He was consumed with doing the right thing. In his tremendously understated way, he did what was necessary as a leader, not as a performer playing to the gallery or to any of us. Wherever he went, he brought with him sincerity, serenity, and integrity. As it turned out, the absence of glibness and his artless decency became his calling cards. And it fostered an unusual closeness to everyone Artie came in contact with. He lives his life with a strong sense of doing as well as he can. He truly believes that if you don't strive for the best, you'll never get there. And he has had one phenomenal career. As was stated earlier, he's currently the Executive Vice President and Chief Growth Officer for Kaiser Permanente, the largest not-for-profit health system on the planet. Kaiser serves 12.5 million members and patients in 8 states, and Artie plays a major role in all of that. He's been with Kaiser for over 21 years and has had national responsibility for health plan marketing, sales, service, and administrative activities. And oh yeah, what else? Oh, he founded a health plan. Okay, I don't know how many of you have ever founded a health plan, but he did. And that's when I first met him. And then he became CEO of HealthNet. Sits on numerous boards, far too many to mention, but he brings his love and expertise to all of it. I have the pleasure of serving with him on the Board of Advisors of the Fielding School of Public Health at UCLA, and I'm privileged by him guest lecturing in my leadership and culture class every year, where he is a big hit. While a resume and career full of accomplishment and success, this is not the best part of who Artie is. Artie was never a striver. He was never working in angle, just working. Kindness and candor are only more prized by their scarcity today. Artie's modest, yet strong. Few have ever risen as high as he has. There's confidence and courage in his bearing. In judgment, Artie is sober and serious, unafraid of making decisions. He's calm and steady by nature. He assumed power without assuming any airs at all. He knows how to treat people with love and respect. Good judgment and fair dealing and the manners of a gentleman clearly define who this man is. Artie brings with him decency, honesty, and steady as he goes qualities, hard to find anymore. The gentleman he is in public is the same gentleman that he is in private. He brings to his work and to all of us no demons, no hidden agenda, and no hit list. He knows who he is, and he didn't require consultants or gurus to change him. It's just who he is. He's the champion of Main Street values, which we can't find anymore. Unusual for the times we live in. You might find yourself as his adversary, but never as his enemy. He's too good for that. Artie brings something special to his work every single day. He brings with him the humanity that comes with a family that seemed to be the family living right next door. He answers courtesy with courtesy. Better yet, Artie even answers discourtesy with courtesy. Artie shows his character in his devotion to his family. For those of you here tonight who don't know Artie personally, I feel sorry for you. It would be like missing out on seeing the Beatles in concert or never having watched Michael Jordan in his prime. Artie, what everyone here tonight has in common is that we are all grateful for your good life, and we are grateful to know you. Ladies and gentlemen, it is for me truly an honor to present to you a truly unusual and wonderful individual. Please join me, get out of your chairs, in bringing up to the stage, show him all the love, our beloved guest of honor, Dr. Artie Southam.
Oh my goodness. That's right. As Tom pointed out, we have the unruly table full of wonderful family who are here, and so I'm fortunate to have 7 of our gang of 10. Usually we travel in a pack of 10. Our 4 children, their 4 significant others, 2 son-in-law, 2 son-in-laws, and my wife Beezy. And so if you hear the rowdy part over here, that's them. Tom, that was incredible. And thank you so much. I met Tom when I was a wee boy, right, long ago, as Tom took on his role at Cedars-Sinai, and he's always been a model and a mentor of leadership. I admire so many things about Tom, including his commitment both to do the right thing in healthcare and the incredible number of people he's developed, and he's invested in the development of a broad range of folks. It's an incredible pleasure. It's an honor to be here. I'm awed by it. It's, the people in the audience have been my colleagues, my mentors, my teachers, people who I've admired, and to be here with you tonight, I think we're all blessed. We've come through this pandemic due to the services and the good offices of many, 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 many people. Our public health officials, our frontline care delivery individuals, the molecular biologists, and so many people who have brought us both prevention and cures for COVID deserve our undying gratitude and respect in everything they do, and we are all blessed for the great work that they do. Let us thank them. It's particularly an honor to be recognized by the Partner in Care Foundation, and you saw through the presentations of Kathy and Jennifer and June why that is. Partners in Care Foundation and June and her founders and her board members were advocating for people, vulnerable people, were advocating for new ways of looking at social determinants of health long before anybody made up an acronym for it. And I think that just indicates the depth and the duration of their vision and their commitment to constructive change and to broadening our sense of what are the things that contribute to total health, health of mind, body, and spirit for everyone, and again, particularly the most vulnerable in our society and our communities. I'm also particularly honored, and it's very special to be here with Sach and Jane, and to, as part of this recognition, reflect on the incredible work of SCAN Health Plan and the SCAN Foundation. Sachin has made many contributions to the industry in a number of ways. His assumption of the leadership of SCAN Health Plan is a great thing for Southern California and a great thing for the nation. I think what SCAN has done in being on the leading edge of social HMOs, of taking care of vulnerable at-risk populations, is leading edge. And then the establishment of the SCAN Foundation as an instrument for learning, for research, and for spread, perhaps one of the most important things that our industry needs more of. So Sachin, SCAN, the SCAN Foundation. So many folks have helped me be successful and helped me pursue my passions. So many thanks to the UCLA School of Public Health. No disrespect to any Trojans out there, but for the UCLA School of Public Health. And particularly among them, my undying gratitude to Dr. Paul Torrens, who has touched so many of our lives, and to Dr. Jonathan Fielding, who have always been mentors and models for the importance of public health and the importance of developing the next generation of leaders for healthcare. So I so much appreciate them and thank them for the way they've touched my life. I want to thank my colleagues from Care America, Health West, and UniHealth. Yeah. Another disruptive and unruly crowd. And I was sent by Dr. Torrens as I was looking for my first job in healthcare out to this warehouse in Chatsworth. and met with this person named Leighton Crouch, who talked to me and said, well, you're a doctor, what are you doing here? And I said, I want to do something to involve running healthcare organizations, and Leighton was part of my life for the 10 subsequent years. As Tom mentioned, we started with 4 people in a warehouse from scratch and an idea and built a health plan. And for 10 years ran that health plan. And there's nothing quite like the act of creating something from nothing. And I think the thing that was even more amazing is there was a group of about 20 of us, 20s and 30s, who had no right doing this. There was no reason why anybody should have given us this responsibility and authority to create that. It sort of led me and probably gave me some of the background to come to Kaiser Permanente. Dr. Torrens, his class in my first year of public health school was my first introduction to Kaiser Permanente. For 4 years, over those 20 years, have worked with 4 CEOs, all incredibly important and effective and innovative leaders, all in their different way, but all in pursuit of a never-changing mission: high-quality, affordable health care that improves the health of our members and the community we serve. But all of them driving that through innovation, and all of them, particularly George Halverson and Greg Adams and Bernard Tyson, driving to being all we can be by being one, by leveraging our capabilities to work together towards the pursuit of excellence and the innovation in what we do. So it's been a pleasure to be part of that journey. What Kaiser Permanente is about, an organization with size and purpose and excellence and accomplishment. We've grown in terms of revenue about 4-fold during my tenure. We're most proud of the work that we've done to be on the leading edge of quality in the Medicare Advantage program and in consumer recognition for our satisfaction, where we've led the marketplace for the last 15 years. So not that anything's competitive, but those are just indicators of the things that we focus on, the things that matter to consumers and quality of care. So in closing, I particularly want to pause and thank my family and my wife, Beezy Daly. Beezy and I met in medical school. She had so many great characteristics, but one of them is she had this 63 blue Plymouth Valiant with push-button automatic transmission, and it came with one of the best parking permits you could have at UCLA, which allowed us to get out of our 12 o'clock class, get to the Sunset Canyon Recreation Center, swim, and be back with wet hair for gross anatomy lab right after there. So grateful to Beezy for putting up with me, for her support, her love and support. I'm so proud of what she's accomplished. She has probably at this point delivered about 3,000 babies. She's delivered many of the children of many of the people in this room. Almost every day or every once in a while, I come home and think I know something about the American healthcare system. And I spout out some thought, and she says, well, I saw 20 patients today, delivered 2 babies, and did surgery. Let's talk about what's real here. And that's so important. So I'm so proud of her, and also so proud of, as she points out, fathers don't have babies, mothers have babies. And we are blessed with 4 wonderful children. 3 of them, Allie, Abby, and Tim, are here with us. Our daughter Molly is in Bora Bora with her well-deserved honeymoon, which has been delayed for 2 years. I love them so dearly. They're so good to me and have been such an important part of our life together and our success. So I thank all of you for all you do. Thank you for being here, for supporting the Partners in Care Foundation and the important work, and just as importantly, the great work that you do within your organizations to improve health in our society and particularly attend to the needs and the circumstances of those who are most vulnerable. Thank you very, very, very much. I'm grateful.
Celebrate a hero, have a great dinner.